to another Ikigai webinar. Thank you for joining us tonight. The webinar will be recorded as usual and should be online within the next 7 days or so on the My NSK website. You can access that on the webinar archive as usual. There's lots of other things on there as well if you'd like to have a little browse. So with both dental therapy and dental hygiene being in the spotlight a lot in the last few years, we thought we would do something a little bit different. So we've organised a panel discussion tonight with some experienced dental therapists who are all utilising their full scope of practice at the moment. They're all going to bring maybe different opinions, ideas and experiences to the table. And we've got some submitted questions that we will go through first of all. And then if you think of any questions while we're speaking, please submit them into the Q&A box at the bottom of your screen, and we will spend the last maybe 20 minutes or so answering your questions from tonight as well. But thank you all for joining us. I'm just going to get everyone to introduce themselves first of all, so that you know who we all are. And so Anna, I'll ask you to go first.
Thanks, Lauren. And also thank you to NSK for joining me to this fabulous panel of dental therapists. So I'm Anna Peterson. I am a dental therapist qualified in 2017 from Teesside University. And since qualifying, I've worked in both the NHS practices and private practices. And I now work solely in one private therapist-led practice.
And Evans, will go to you next.
Thank you, Lauren. So my name's Ibrahim Numan. Everyone just refers to me as Ibs or Ibby. I'm a dental therapist, originally based in London, fully utilising my scope. And for the last sort of 3.5 years now, I'm based on the South Coast down in sunny Brighton, definitely sunny today, and have been practising dental therapy for about 5 years now.
Awesome, thanks, Ibs. And Pat?
So I'm Pat Popat and qualified from Essex University in 2014. I'm a practice owner and work in other practices as well as a dental therapist. I do a lot of facial aesthetics and hygiene and therapy. And I use most of my therapy. So that'll be quite interesting as we go through the panel discussion tonight. Because I know when I speak to other therapists, some are not utilising their full scope, some have trained and not used it. So it'd be good for you guys to throw your questions in and we can, have a good discussion.
Yeah, absolutely. That's what it's all about tonight. So my name is Lauren Long. I have been a dental therapist for 16 years this year. 2008 I qualified in Dundee. I have been utilising my full scope for around about the last 12 years or so, I think. I also work as therapist clinical director for a small dental group, so helping other therapists to utilise their full scope as well and to reskill where need be as well. So I think that's a good point to kick off on, because I think we all kind of mentioned there that maybe we started off out of uni maybe not utilising our full scope of practice, and I think that's quite a common thing, when we first come out of university. So if we could maybe chat a little bit about that. So Ibs, I'll maybe go to you first. Can you maybe tell us about some challenges that you've faced since graduating on utilising your full scope?
Yeah, absolutely. So I was adamant that I'm going to do dental therapy, because I remember when I first looked into it, and speaking to nurses, everyone was saying, well, you might as well, this is when the qualifications were separate, you might as well do dental hygiene. No one really works as a dental therapist, etc. And then when I did my training at the Eastman, I was very adamant to sort of go out there and do dental therapy. And of course, my first ever job was dental hygiene, because there was no dental therapy opportunities out there. And I worked for a corporate dentist as a dental hygienist, and started off there just to build up my confidence with seeing patients, and still on the job hunt. And I actually worked only 2 days a week, so I could go out there and find something. When I applied for a lot of jobs, although the advert said dental therapist, when you went to the interviews and met the practice owners, etc., it was mainly for dental hygiene. And to them, dental therapy most of the time is you could do a couple of fish sealants on paediatric patients, and that's your dental therapy sorted. So I was working in Fulham for about 3.5 years, And the lovely practice owner there was very, very honest and said, I actually don't know what a dental therapist is or what a dental therapist can do. So the biggest challenge for me was I think whenever we talk about dental therapy today, with a lot of the questions, we're probably going to be talking about patient perspective as well as perspective from your colleagues and educating them. So the main challenges was educating the dentists, the dental receptionists, my other colleagues, nurses, etc., make everyone aware what I'm capable of doing, but more importantly, what I was comfortable doing, because I think that that's a really important conversation to have with your principal and what you feel confident in doing. So I started off trying to put with hygiene there, and we tried to grow the therapy books, and I made a lot of effort with the dentist to see how she did her treatments, because if she was then going to send patients to me, I would observe, I would even nurse for her for a couple of patients, just to see how she works. So if patients then came to see me, it wasn't too disruptive. We kind of worked in the same way. So that's exactly what happened. And eventually she trusted me and the patients trusted me once I built that rapport. And we moved on and started introducing dental therapy into my diary. And the challenges are hygiene is really, really popular. And your diary gets booked up with a lot of hygiene appointments. See, it's learning how to negotiate with the principal dentist and the practice manager to maybe zone your days and segregate certain treatments for certain days. And, I have therapy days now and hygiene days and just work through it that way. But yeah, it's definitely like everyone, I'm sure, it started off as hygiene, and it's just a constant knock on the door, I say, until you eventually kick that door down and get to do what you really want to do.
Yeah, absolutely. And I think what you're saying is probably quite relevant to a lot of people in that, we're often the ones that have to advocate for ourselves rather than practice principals coming to us and asking us what we can do. Sometimes we have to, as you say, kick down the door, knock on the door gently,
exactly,
and let them know. Thanks for that, Ibs. Pat,
no worries.
Do you have any opinions on that?
Yeah, I totally agree. Ibs is right. You end up in practices after qualifying and the same thing. Oh, you're a therapist. Yeah, there's loads of work for you, and they're really eager and they talk it up, and then nothing. It's your diary's full. 8:30 to 5:30 hygiene back to back, and you have to just. I think the minute you get a chance to showcase off your therapy skills, take pictures, discuss them with other team members, the principal for certain, and then you start to find that they do trickle through. In what you might start off just getting the really NHS ones that no one wants to do. Suck it up, enjoy doing it, learn from it. You'll make mistakes if you haven't done therapy for a while, or you might, your work won't be as good as you want it to be, but it's fine. It's part of the learning process. So I definitely think, just keep hounding that door. And Kat's in the house. Here she is. Welcome, Kat.
Hi, Kat.
You're on mute, my love.
Sorry, everyone. I do apologize. Hello, everybody.
Hello, Kat. So I think, like Ib said, you've just got to be constant and look up. There's some great therapists like Kat, like Lauren, like Anna, Ibs, and there are others out there as well showcasing their work. Tap into these guys and ask questions. Like, everybody's ready to help each other. I think that's the beauty of our industry, is that actually we all want to grow and we all want to get better together. That is not like in dentistry with dentists. Sometimes it becomes a bit like, well, I just want all the work and I'm not going to share my secrets with you. Whereas I think hygienists and therapists love spurring each other on and seeing each other progress. So reach out as well. Don't be afraid.
Brilliant. Thank you so much, Pat. And something just you touched on there that actually we had a question about. You spoke kind of briefly about, kind of almost creating a portfolio of your work, taking photographs of your work and whatnot. So with dentistry moving more towards digital equipment, how can we as therapists utilize and leverage that? Kat, we'll go to you first, since you're just there. You can introduce yourself if you want as well first.
Thank you so much, Lauren. So I'm Kat Edney. I'm a dental therapist. I work in private practice in central London, and digital is really the one thing that has massively elevated my career, my ability to work the way I want to work. I work as a direct access dental therapist, essentially. So I run a therapy-led model in our practice in Canary Wharf, where I do all the checkups and I refer my patients to the right dentist for them at the right time. And the only way I can do that is by having amazing communication tools. And that's what digital gives me. So I'm able to take scans, I'm able to take photographs, and that's my way of communicating with my clinicians. So I can send the dentists, the dentists with a special interest in endo, I can send them a HD scan of the tooth, images of the tooth, radiographs of the tooth. They can see 360 degrees around it. They can see the occlusion. They can see restorability. They can see a lot of information about the patients as well. And so they don't necessarily need to do a consultation prior to most situations. That's how digital's changed things for me, because in the past, it was really such a massive lack of communication. But even if a dentist was sending me restorations, I didn't really know what was going to turn up on the day. And I'm sure there's a lot of people thinking, yep, I've got that exact situation. They say, oh, it's just a DO on a 7. And you're like, actually, this is not just a DO on the 7. It's like subgingival, it's fractured, and that makes it really difficult. But now I always take a snapshot of a scan. I always annotate that scan and say, listen, patient's goals are alignment here, we've got fracture there. It just really, digital is a huge deal for me. And on the side, I also love taking photographs and using them to really improve what I do. So I look back at a lot of the work that I do, and think, oh, how did this restoration go? How did I do? How can I improve? How can I improve shapes and things like that? And that's where I've really grown with my restorative work as well. And I'm sure a lot of those of you in the panel again this evening are feeling the same way, that, when you take pictures, you might be feeling really bad that day about the restoration you did and thinking it's not amazing and, oh, that patient's going to come back. And then I often find if I look back a few weeks later, when I'm in a bit of a better headspace, I'm like, well, actually, I didn't do such a bad job on this. Maybe I'll put it on Instagram.
Thank you, Kat. Anna, do you have any opinions on that?
Yeah, I mean, I completely agree with what Kat has said. But I also find that digital tools for me are like my safety net. I used to see patients and I'd do an exam on them, like really early on when we were doing like a therapist-led model in practice. And I was finding that, if I needed some reassurance, the dentist would have to come in and look at that patient and sort of confirm things that I've said or something like that. But for me now, I will see a patient, I will do a digital scan, I'll take DSLR photos, we're taking x-rays, and I have all of that information that if I need reassurance, I only need the dentist to just look at that. I don't need them to come in to the room, especially if they're busy. That's not always doable. But what I also find with doing all that is, I think if you're starting off, sometimes one of the hardest parts is actually the treatment planning. Sometimes you just need a little bit more time. You can't just think it up on the spot. Patients walking out to the waiting room. You just need a bit more time. If you have the scan, you have the photos, you have the x-rays, you've got the time to really think about what that patient needs. But on top of that, if you bring up the photos and the scan in that appointment when the patient can see it, sometimes I'll bring a photo up and I know that I want to explain to that patient, okay, you need a filling in this tooth. Before I've even got to the TV screen to show them and point to it, they're saying to me, what is that? I feel like I need a filling there. And it's immediately like they've beat me to the point. Like, they can see it, so they immediately trust me, because gone are the days where they just have to take your word for it. You're looking in the mouth, you're telling your nurse that they need XYZ treatment. The patient just has to believe you because they can't see it for themselves. But you put a photo up on the screen or you show them their digital scan, they immediately can see it. And you will also find that they're telling you more treatment that they need, that you may have not been thinking this is an absolute necessity. You know, they're looking at their teeth from different points of views that they've not seen before. And they're thinking, actually, do you know what? I think I do want my teeth whitened, or I think I do want my teeth aligned, or actually that bit of wear on my teeth, that does really bother me now that I can see it, and I would like something done to it. So I think it just elevates everything that you do in practice if you have these digital tools. So yeah, so that's really my opinion on digital tools.
Awesome. I think as well, something you just touched on a little bit there, Anna, is medical legally as well. It's your protection, right? So,
Yeah.
you know, if you've got these records, you know, we've all heard it. We have patients that come in and they say, oh, well, I got this filling from my old dentist, but I don't even really think I needed it. You know, if you're showing the patient and they're telling you almost, you know, this needs to be done, it's a good kind of backup to have as well on the patient's records. So I think it's helped us a lot, definitely. So Ebbs, I'm going to ask you, where do you feel that the public awareness of dental therapy sits? I know Kat mentioned obviously that she's doing the exams in her practice. I know a few of the rest of us do that as well. How do you feel, you know, that the public, are they aware of us? You know, are they comfortable with us doing their exams? How do you feel about that?
I would love, I mean, it depends on patients, I would say that to start with. But the public awareness of dental therapy, I don't think is still where it needs to be. It doesn't help when you've got, you know, our Prime Minister on TV saying dental therapist. I think they're called dental therapists or therapist, and referring to us with the wrong title to start with, that don't really punch in confidence to patients. I always start off by introducing myself as a dental therapist. Some patients question it. Some patients ask if I can talk to teeth. And some patients don't care really, because they're there and they may refer to me as a dentist and I will correct them. But the awareness is still not where it needs to be. I think it's improved. I'd like to say that my patient base definitely knows what I do and what I can do. But unfortunately, I don't think there's enough out there about dental therapists. I mean, a lot of the time when I introduce myself, I'm sure everyone on the panel will agree, a lot the question, oh, how long has dental therapists been around for then? Is that a new thing? You know, they're not even aware that we've been there for many, many years. And you know, although we were mainly placed in community settings, dental therapists have been around for a long, long time. And it's just finding the correct wording to reassure that patient. And I'm sure everyone has a different way of saying it, but I always try to talk about multidisciplinary practices. I know Kat's a big fan of that as well. And, you know, comparing it to the medicine field and saying that, you know, if you had something wrong with your, I don't know, your back, you'll go see a physiotherapist. Or in the medicine field, it's not, you don't get eyebrows raised at all. Whereas at the dentist, you know, why do I need to go see someone else for this? It's just educating patients and getting your point across on that front. And actually, patients quite like it, I find, because they feel special. You know, if you're calling in someone else for an opinion or discussing a case, saying that I need to discuss this case with you, this is what I do, this is what I'm passionate about, all of a sudden patients feel quite special, and that goes a long, long way. But yeah, a long way to go on public awareness, I think, but we're getting there.
I think we're definitely getting there. Anna, you got any opinions on that?
Yeah, I agree that I think we've got a long way to go, but I do think that we're so much closer to where we need to be as well. I think all over social media now, you will find dental therapists, whereas that wasn't really the case 10 years ago. I do a lot of videos on TikTok, and I will try now to introduce myself as, hi, I'm Anna Peterson, I'm a dental therapist. And quite often I will get comments like, she's a what? She does what? You know, And I still get messages saying, "Hey doc," you know, and it's like, no, I'm not a doctor. Like, they're just not quite grasping what we do. And so I think we still need to do so much more to get the title out there. And I think it's not even, you know, we want the public to know what a dental therapist does. We want them to know it's a thing. Like, dental therapy is a thing. Like, I think they've just never heard of it. So yeah, I think there is a lot more that needs to be done. And ultimately, I think it begins with us. You know, we can't expect the public to know it if in our practice, not every clinician or member of staff talks about you as a therapist. If one of the associate dentists is saying, "Oh, if you go in and see Anna, our hygienist," then the term's gone. And, you know, or if a patient comes in and they say, "Oh, it's been, you know, so many years since I've seen a hygienist," and you don't say anything about the fact that actually you're seeing a therapist at the moment, you know, and it is an awkward conversation to have. And sometimes you don't want to immediately almost come across as defensive, but we need to find a way that we introduce that title to them, because I think there are a lot of patients. I mean, I don't know what the percentage of hygienists and therapists are in the UK, but I bet the majority of patients that see a hygienist are actually seeing a therapist, and they have no idea that they're seeing a therapist. So I think it's so important that we push that message, and in our practice, we highlight that you are a dental therapist, you know, make sure that your patients know, and the word will spread, but it starts with us.
Absolutely. And on that note, Anna, you know, we've probably all had it. We've had the one dentist in the practice or the receptionist or somebody, you know, who will not refer to us as a therapist. They'll tell patients we're a hygienist. So how important do you think it is that the team are involved in, you know, pushing dental therapy in the practice, informing the patients, and letting us be utilised to our full scope?
I think it is probably one of the most crucial parts, because if your receptionist doesn't know what your scope of practice actually is, you know, they don't know that you can do any more than just a hygiene appointment, they're never going to book you. They're never going to book the patients that you can do restorative work on, or, you know, see pediatric patients for checkups. You know, you're never going to get that because they don't know, and they don't want to make a mistake. And that's completely fair enough. You know, the training needs to be done in-house so that every member of staff knows exactly what you can do. And I think with that, I would say it's important that you make it clear what you feel competent and comfortable to do. Because if you just give them your scope of practice and actually you do not feel comfortable to do a checkup on an adult, then, you know, you just need to tell them, but tell them what you are comfortable to do, and they will book you those patients. And I think, like I said about the dentist, the associate dentists, they need to be calling you a dental therapist, not a dental hygienist. Even if all they want you to do is the hygiene work for that patient, still call you a therapist. Yeah, so I think, you know, take the time. You can hold the presentation or the meeting yourself. It's what, half an hour with your practice, and just explain what you can do and make sure that everyone's on the same page. Because your reception team will thank you, because they will have patients phoning up and maybe they've broken a tooth, and the reception team's thinking, "Oh, there's no appointments available with the dentists," and they could be booked in with yourself. You know, if they could, so it's going to like free up the dentist's diary as well. It's going to keep you busy, and you're going to be doing more of the work that you want to do.
Amazing. I totally agree with that as well, because, you know, I am in my practice, I know we probably all are, like, totally militant about being, you know, called by the right name. You know, I hear someone say the hygienist, I'm like, therapist, you know, they're probably all sick of hearing it by now, but, you know, you have to, and actually, sadly, I trained with someone who actually did end up in front of the GDC because a patient reported him for doing a filling when they thought he was a hygienist. And it actually turned out not to be his fault, because he had explained to them, put it in his notes and whatnot, but then another staff member had referred to him as a hygienist at reception, and the patient got the wrong end of the stick and thought something had been done that shouldn't be. So it just shows how important it is for us to explain that to all our patients. But yeah, I think I think there is definitely more awareness within the profession. I don't know how you all feel about that. I feel, you know, when I qualified, in Cat, I know you qualified the same year as me, 16 years ago. I feel back then, even within within the profession, awareness was quite low, right? You know, you would have to go in and you would have to explain it. It's better, but it's maybe not quite there where it should be in the profession either, never mind the public. So on that note, Kat, I'm going to ask you, do you feel that there is a difference between, you know, the NHS and private settings on how well therapists are integrated into practice?
Yeah, I mean, I think it's always a struggle, no matter whether it's private or NHS, let's be honest. I don't think anyone is not finding it a struggle to be well integrated. I certainly find that obviously I'm same as you, Lauren, like we travel a lot up and down the country speaking to therapists, and I find that the further north you go, the more therapists are being used, but they tend to be used more in NHS settings. In the south, we don't tend to see that many therapists being integrated, and we really don't see them being integrated into the NHS. If therapists are integrated, it will be a high-end practice that has been progressive practice, progressive dentists who suddenly think, hang on a minute, there's something I can do with this profession. And so in the south, we don't tend to have NHS therapists, although there are a number starting to come out now. And I've got a very good friend, Monica, who is just the most amazing NHS therapist, absolutely rocking it in the south of England. So, you know, there's obviously pockets where it's starting to become much more widespread. I think in terms of integrating therapy into the NHS, it's a struggle. We're still not where we need to be. I mean, we still can't prescribe LA, and we can't use a PGD on the NHS. So that really puts a massive brake on any progress for therapy within the NHS, because ultimately, what does an NHS dentist want the therapist doing the work for if they're still going to have to come and prescribe? It doesn't really make financial sense. It means that the dentist is constantly being called on again. And we're not just talking LA, we're talking fluoride, right? So this is something that therapists can take on a full pediatric scope on the NHS, yet can't prescribe fluoride. It's craziness. So I think it's coming. I think integration will be better. Obviously, our associations have done a load of work on this. And I think eventually we'll see therapy definitely being used a lot more on the NHS. How that will look, how the contract will look, I hope it will be different to what the contract we see today. And I also really hope, truly hope, that more progressive dentists, practice owners who own private practices, start to realize that there is so much benefit and growth to be had when you integrate every team member. Obviously, this is the way I'm working now, and we see a huge growth in our practice finances, in investment in our practice as well, when we work in a therapist-led model. And, you know, I'm really hopeful that the more that we talk about it, the more that we're open about the fact that we can help with financial modeling in practices, and we're not too shy about it. You know, and I know a lot of us don't like talking about money, but the more we can prove that actually integrating every team member isn't just a nice thing for therapists, it isn't just letting the therapist do the job, it's actually making the practice more profitable. It's making dentistry work in a climate where it is very difficult to make these businesses work well. Therapy is kind of the way forward. So I'm really hopeful that we'll see more growth and more integration. It's not there yet. There's so much work to be done. But I really think it's coming. I'm so excited to see where therapy goes in the next 10 years, because the last 10 years we've seen massive changes and massive growth. So watch this space, I would say.
Awesome. Thank you, Kat. How about you, Pat? What do you think?
I think, yeah, pretty much the same as what the rest of the panel is saying. It is progressing, and it's progressing fast. Like I said, I qualified in 2014 as a therapist, and even since then, right, 10 years, that's excelled, and we're seeing a little bit more utilization. Like Anna said, you know, I think it's right that the rest of the team do know who we are, and we are using the title, and the dentists actually address us in that way, so that as it's just banging the drum, and more people, dental therapist, because it's either dental hygienist or dentist. There's no in between, but we are here. So yeah, I think everybody has to bang that drum. We do, the rest of the team do, and I still correct. One of my receptionists, she broke a tooth, and I filled it for her, and she still called me hygienist to like my patient. I'm like, hey, I'm your therapist. Tell people I'm a dental therapist. So yeah, I think it is just keep banging away and making sure that people use our title.
Absolutely. So once we've hopefully got ourselves integrated into practice, what opportunities do we think there are for career progression as a dental therapist? I am going to go to you, Ebs, first for that one.
Yeah, so loads more opportunities than there used to be. Again, we're seeing quite a lot more private companies out there now running postgraduate diplomas, etc. But I think the most important thing when it comes to this is, what are you passionate about? Finding what you would like to, what field you would like to go down. Because yes, we have a limited scope, but if you're using it to your full potential, then there's actually quite a lot to do. I mean, cosmetic dentistry and the composite boom has been flying for the last sort of 7-8 years now. And I do a lot of cosmetic dentistry, and I would say that actually a lot of my therapy is a lot of sort of bonding and composite veneers that I'm doing at the moment, because that's what patients want. And I'm currently studying a postgraduate diploma in restorative and aesthetic dentistry because that's what I want to do. But I am seeing a lot of pediatric patients at the moment in one of my practices, because the dentist does not want to see any pediatric patients. And I found a new love to treating pediatric patients, and I'd like to go on more courses and develop my skills in that front. And it doesn't always have to be a particular field. There's great communication courses out there to help you develop as a dental therapist, which I speak to quite a lot of students on behalf of the BADT, and they always say, what's the best course to go on? And I always push them in communication first and foremost, because I think that's the most valuable. And a lot of the communication courses I've done personally have really helped me develop my dental therapy, how I explain myself to patients and how I could upsell patients, which again are uncomfortable conversations, but these are conversations that we should be having. So I think there's a lot of opportunities out there. I think now that the NHS has jumped on the dental therapy bandwagon, and I'm not sure if we're going to touch on that, like Kat was saying, there's still a lot of grey areas in the NHS side of things. But NHSE is actively running quite a few courses as well for dental therapists, and how to carry out dental checkups, and just find the field that you're passionate about and what you want to do. And there's so many courses out there, so many opportunities out there for you to go out there and develop your skills and progress in what you want to do. And if you want to take a step back from dentistry and go into teaching, or speaking on topics that you're passionate about, then go for it. I think there's more and more opportunities out there for us to grasp on that and talk about dental therapy like we're doing right now. So if it's something you'd like to do and you're interested in doing, then maybe it's a postgraduate diploma in education, and you going down that route. But I think there's so many opportunities out there now, and I'm hoping, like Kat said, in 10 years there's going to be the tenfold. So yeah, find your passion and follow it is my advice.
Brilliant. I think that's key, isn't it? It's doing what you love. There's no point in doing a course in something that you feel like you're forced to do, that you don't enjoy. Pat, I know you've gone in a bit of a different direction. You do a lot of facial aesthetics, and so do you feel that has helped you progress your career as a dental therapist?
I think so. Again, it's talking to patients, and even when you're doing hygiene work and you see something that's therapy related, patient's got a chipped tooth or something's broken. Oh, I can fix that for you. Oh, okay. Well, I'm a dental therapist, and you kind of explain your role a little bit to the patient. And I think one of the things I found is I've done things slowly. So, you know, just try to focus on one part of my therapy scope at a time. Didn't think, right, let's just kind of start doing exams. Let's start, you know, doing the whole scope straight off the bat, because sometimes it can be overwhelming. So it's like, okay, well, we've got a peds patient, right? Focus on what do I need to do differently for peds, and what do I need to do for an adult? Like Ib said, communication's different, and just get comfortable with, if you're going to do exams, just get comfortable doing exams, you know, and making sure that you can go through all of those steps. And like Kat said earlier, she can look at a patient and she now knows who to refer what off to, you know, what piece of work, and just build up your scope. So don't ever think, oh, right, I'm a therapist and I need to do everything and match another therapist. I think you definitely just need to build up your scope bit by bit and get better at each bit of it. I think so.
Absolutely. I think it is quite tempting. I think when we come out of uni, we're always all like powered up and we're like, we want to do everything. You know, you want to do every course, you want to learn every skill. But I think consistency and kind of sticking at it is key, right?
Yeah, for sure. I think, like, again, there's so many courses, as Ibs touched on, out there, you know, offering different things. And make sure if you are going on a course that you are able to integrate your course into practice, because you can go on these things and you can de-skill really quickly. And then you feel disheartened because you've been on a course and you think, well, yeah, I did this really great, you know, composite veneer on a model, or I did a really nice class 2, you know, composite, and I sculpted it really well. And then you do nothing for 2-3 months, and then just the rubber dam takes up most of your appointment, and let alone you're all stressed about time, then your composite flops, and you get all worked up. And, you know, I think there's got to be a way that we can, you know, integrate more into practice. That's I think my thing is that trying to make sure that we can utilize courses that we go on in practices, because I've been a victim of it too. I've come out of a course and then just not utilized my skills, and I have de-skilled. So then it takes time on like trying to rebuild that. But I keep extracted teeth and I sit and play with them. So that's kind of how I keep myself going sometimes.
A little collection. Thank you, Pat. Okay, so we'll finish off one more submitted question and then we'll move on. So we've had a lot of questions submitted as well. So Kat, we're going to go to you first with the big question. And we've talked about the last 10 years. Where do we think dental therapy is going to be 10 years from now?
Oh my goodness, are you ready for this? I don't think any of us are ready for this. I'm going to make a prediction right now. We're going to be doing indirect restorations in 10 years' time, utilizing digital tools. So I think printed restorations, CEREC restorations, we're going to be prepping for crowns and veneers. We're going to be looking at a lot more around occlusion, a lot more therapists opening their own practice. I think we'll have our exemptions. I think we'll find that the growth of dental therapy will mean that it's going to push dentists to specialize as well, and push dentists to move more into their special field of practice. So even just special interest MSc dentists, because therapy is going to really grow and push. I'm super hoping that the GDC will be like, yeah. If you're trained, competent, and indemnified cat, then yes, you can stick a CEREC on that tooth. And that's my prediction for 10 years' time. And I tell you what, if no one else is going to make it happen, it'll be us.
Going to be a busy 10 years.
Give me 2 years of the scanner and the GDC and we'll get us there.
We'll come back in 2 years and see. Thank you, Kat. Anna, what do you think?
Yeah, I mean, that's made me all excited thinking about what could happen in the next 10 years. I think my wish is maybe a little bit smaller on scale, but I hope that more practices are hiring dental therapists and then allowing dental therapists to use their full scope. I think we're gradually seeing it happen. We're gradually seeing more practices take on a therapist and see the potential And I think it's one of those things we just need to trust the process. If a practice owner takes on a therapist, they will be rewarded. They just have to trust the process. Because I always say, who is the most appropriate clinician to do that work? You wouldn't have an endodontist doing all the routine checkups and then have no time in their book to do endo work. You know, why should the dentist be doing the checkups and the fillings when a therapist can be doing that? A therapist should be doing that, which then frees up the dentist's book to be doing more financially profitable stuff. And it just makes more sense. The therapist will be happier, the dentist will be happier, the whole practice will be making more money. I just think that's the way forward. I just think more practice owners need to see that and see it long term, because it's not going to be something that happens overnight. You can't hire a dental therapist and then next week the dentist's book is full of aligners and crowns and bridges and implants and things like that. It will take time, but it will get there. And that ultimately is surely the goal for a practice owner, a dentist. They want to be making as much money as possible. And that is how you're going to do it. They just need to trust the process. So that is my 10-year hope.
Absolutely. Thank you, Anna. And I think, as Kat said, I think more and more progressive principals are utilising dental therapists. Feel it changing a little bit, and we'll see where we're at in 10 years' time. So we're going to go to some questions that have been submitted tonight. Kat, one for you, first of all. What is a therapy-led model that you were speaking about earlier?
Well, therapy-led means that the therapist is in the centre of patient care. So your patient is going to come in and see a therapist for their checkup, just like Anna's just explained. So your therapist will do your checkup, will take all the information about that patient that you could possibly ever need. So we're talking radiographs, scans, photographs, hard tissue, soft tissue, oral cancer, perio, where, you know, everything, all that information will be standardized across the practice. So everything any dentist in the practice might need to know about a patient, the therapist will information gather about that patient and then create a treatment plan and direct the patient to the right dentist for them at the right time. So for instance, today, the patient that I had this afternoon comes in, we've done a full checkup, scans, photographs, x-rays. I've sat them down, showed them their scan, because as Anna says, when they see the scan, the science is right. They don't have to trust me anymore. They just trust the scientist. And I say, right, you know, you've got a fractured tooth here, which is symptomatic. I think it's probably going to end up needing an onlay. It's probably better if you go to the restorative dentist for this one. I could try the composite if you want me to, but if it ends up needing something bigger, then it's going to be 2 appointments. So this one, I want you to go see the restorative dentist. You're going to have a bit of stabilization with the hygienist because you've got some inflammation. And then you're going to come back to me, maybe for the odd composite. Once you're stable, I've done some treatment, the hygienist has done some treatment, the restorative dentist has done some treatment, patient is stable, then we're going to send you to our orthodontist for your aligners. We're a big Invisalign practice. And that means that my restorative dentist only does restorative dentistry, right? They only do porcelain, and they're amazing at it. And it's their passion. And so it means that when the patient goes in their chair, not only is the patient already signed up to the treatment, they're already committed. They're not going to come and say, oh, actually, I've changed my mind, because they're sat there. So not only are they the patients all converted patients already, but they're seeing the dentist who's going to give them the absolute best treatment. You know, I think we all know that we work with dentists who, one of them you might send your mum to for an extraction, but you certainly wouldn't send her to them for, you know, endo. So we all know which dentist has the talent in which area of dentistry. It's just that we, in our practice, don't hide that fact. We just say, you know what, you're really good at endo, but you're really not amazing at perio. Why don't you just not do the perio anymore? And that's what therapy-led does. I'm almost like the conductor of an orchestra. So I'm saying, you play now, and then I'll organize that alongside our TCO and make sure the patient gets booked in. Absolutely, it's super slick. and everyone's got all the information they could ever need about a patient before they land in their chair.
Brilliant. Thank you, Kat. I think both myself and Kat work to that model. I've done for a while. So if anyone wants any more information on how to get that into their practice, then contact either of us and we'll be happy to help you. So Chloe is asking, I have been in the same practice for about 8 years. I've been referred to as a hygienist this whole time. Can I now ask the entire practice to call me a dental therapist? I would say yes.
100%.
I would definitely say yes, Chloe. And I think even if you're not doing any restorative at the moment, I think it's still important that they refer to you as a dental therapist. And I think it's good just to get the whole team together. It doesn't have to be a big thing of, you know, gathering everyone together so you can make a big announcement about wanting to be called a dental therapist. You can do it during the team meeting. You can go around them individually and, you know, whatever you feel works for you, because I know some people don't like to do, you kind of draw too much attention to it. But what do you guys think about that? Can she ask them?
I think so.
I think she needs to
I think
wear
you
a
can
I'm
just
a
say
dental
to people.
therapist. Sorry, Pat, I was going to say, I think she needs to wear I'm a dental therapist t-shirt. But
Yeah.
no, I completely agree. I think just mention it to everyone, and yeah, she should definitely identify as a dental therapist. And it's a conversation starter. Why do you want to be called a dental therapist? Well, because I want to do more dental therapy. There you go. That's your road into doing more therapy. So yeah, absolutely.
Awesome. So we've got someone else asking a big question that we've all come across. How do we get past a dentist who feels threatened by dental therapists? Anyone dealt with that in recent past?
A lot of times.
Yeah, same.
Sometimes it's a case of just having a really open, honest conversation. I also find that for myself, it's been a case of laying my cards on the table and saying, like, I sometimes feel really worried about what I've done. I often send my fillings, my preps to the dentists I work with, because I want them to tell me, do you know what, I wouldn't have done it that way, or I'd have done it a different way. Even because no one's right or no one's wrong, but it's just a way of understanding how we like to treat. And if I know, for instance, how my restorative dentist likes to place a core before they're putting a crown, then I can say to them, listen, I've done this restoration. I think it might need a crown eventually. Here are the steps I did. It's exactly how you do a core. You probably don't need to put it all down. You can probably just prep it, right? So that those sort of open, honest conversations lead to more growth and more collaboration. But it is tricky. And I think it's a case of laying your cards on the table and saying, I'm not perfect. None of us are perfect, but let's collaborate. Let's see what we can do together. And let's just be honest.
Brilliant. Great answer, Kat. Someone's got quite an interesting question. I quite like this one. So they want to know, what are our favorite, most educational Instagram accounts for dental therapists?
Oh.
Does anyone have a favorite?
Well, it's got to be all of you guys, obviously.
I can't put a name on it, but I follow quite a few dentists abroad that do amazing work. Yeah, I mean,
I personally have a mentor who I followed to start with, and then I was taught by, and then continues to be my mentor now, and that's Dr. Ahmad Tadfi. He is the most amazing restorative dentist. I just think he's incredible. If you follow him and anyone similar to him, like who are members of Style Italiano, I think you will always have some amazing insights into dentistry. I also really love it when George, the dentist, posts, and he posts his step-by-steps. That's always been really helpful. And then the other one that I follow a lot is Jazz Golati. He is Protrusive Dental Podcast, and his occlusion education is second to none. Well, actually, there is Riaz. Okay, we didn't say second to none. He's very good. So those are the three that I have really learned a lot from afar and also in person. So those are my favorites. And obviously I try very hard to mimic their quality on my own Instagram account, but we're just working on that at the moment.
I was going to say you, Kat, because like you often see me liking your posts and stuff, and you know, I think looking up to other therapists, you know, and going, right, So Kat's done it like this, and you do your step by steps. So, and you, I like the way you annotate your stuff for social media, so that I've learned from that, and I'm like, okay, cool. I didn't look at it like that, and actually I've seen this. Yeah, so you learn from each other, you know, as therapists as well.
Yeah.
So yeah, looking at Style Italiano guys, or there's a chap called Dental Mentor, I think, on Instagram as well, and there's loads of stuff there. But I just think there are therapists posting, and you know, we look up to each other, I think.
Yeah, completely. To be honest with you, I try really hard to not post only my massive successes. You know, they're obviously they're few and far between, I'll be honest. Most of my dentistry is very standard basic dentistry, but I think we have to be very careful with Instagram, that a lot of people do post the absolute most amazing restoration that they've ever done in their life, and they post it 200 times from all different angles, and it can really affect us. And I think it's really worth learning from other people's mistakes as well. So I do tend to, on my stories, put up stuff that is like, oh, this was difficult, you know, or this was really difficult, or this was actually easier, and try to be a bit sort of real and a bit honest about it as well. And that's one of the things that I really enjoy about following other therapists, because I think we're all in this game together and we're all sort of learning together. So there are a number of therapists that do post sort of now and again, but I think it's the age-old problem that sometimes the work for them isn't as regular as it is for the dentists that we follow, you know, so the posts may not be as regular.
Yeah, absolutely. I would totally echo that as well. I think I've probably learned the most on Instagram through fellow therapists, you know, because I think we're all in the same boat, and I think we do tend to be quite honest about our successes and failures when we're posting on Instagram as well. I do like the Style Italiano page, and if anyone doesn't follow them, they take lots of different members and post cases and things like that, but it can be a little bit intimidating. So, you know, have a look at, I'm always looking at it going, mine's never going to look like that. But yeah, I think following fellow therapists is definitely the way to go. And there's so many on Instagram now who post amazing stuff. I like, there's not even anyone I would single out. I think everyone's great, like, for posting on there at all, because it can be quite, you know, everyone does it themselves. You look at it and you look at it again, you look at it again, you're like, can I post this? Are people going to be like, that's terrible? And I think it's great that, you know, we don't tear each other to shreds. We just, you know, we appreciate what each other are doing, and we're all in the same boat.
Yeah.
So sorry, go ahead, Anna.
I was just going to say, I couldn't agree more with that. And I think it's great that we follow other dentists. But sometimes I think to myself, oh, well, yeah, that's because they're a dentist. They have the time, they have, you know, all the equipment to do that. Therapists would never be able to do that. And then you follow other therapists and you're like, well, hang on, they're doing it and they're doing it, so I can do it. And it builds confidence in other therapists if we see other therapists doing that work on social media.
Absolutely. So I think we will end on that note. We've got to hand over to the hygienists now. They're going to do the same as us. I know they've had loads of questions submitted as well. Really sorry, everyone, that we did not get through all the questions. There have been so many questions this evening. What I will do is I will direct you all to the Ikigai Facebook group. We can pop a little thread on there just where, if you want to have any questions answered. If you don't want to, you know, post under your Facebook account, if you want it to be anonymous as well, you can email us. So I'll put the email address on the post as well, and you can send on any questions. I think we weren't expecting quite as big an influx as we had this evening, but I hope that's been valuable. And thank you so much for joining us, and we will hand over to the hygienist. Thank you to the panel as well. Thank you to Kat, Pat, Evs and Anna for joining me this evening. And I think Siobhan is going to come in now and take over, and we'll continue with the hygiene part. Have a nice evening, everyone.